The dangerous exercise mistake that keeps millions of sciatica sufferers stuck in pain. Millions of people. Right now, today, millions of people are performing sciatica exercises with genuinely good intentions, real discipline, and real hope, and staying exactly as stuck as they were 3 months ago. Not because they're lazy, not because their case is somehow untreatable, not because sciatica is just something they have to accept, because of one specific mistake, a mistake so widespread that it doesn't just affect people doing the wrong exercises, it affects people doing all the right exercises too. This mistake has nothing to do with which stretch you choose. It has everything to do with how you're doing it. A single detail so easy to overlook that most people go their entire recovery without ever hearing it named. Today, Dr. Dan H. is going to show you exactly what it is, why it's kept so many people stuck for so long, and the specific correction that lets your correct exercises finally do what they were supposed to do all along. This is Health Fix Zone. Let's go. New here? Hit subscribe right now. Real clinical truth about sciatica and back pain every single week. Hit the bell so you don't miss it. Part 1, the mistake, chasing intensity instead of position. Here it is. The mistake is pushing every stretch as deep and as far as possible, treating more intense as more effective, believing that if a stretch is supposed to help, then a stronger version of that stretch should help more. This instinct feels completely reasonable. Most of us learned that with stretching, more range of motion, more depth, more hold time equals more benefit. That's often true for ordinary muscle tightness. It is not true for a compressed nerve. And applying that logic to sciatica is precisely what keeps so many people stuck. Why more depth makes things worse, not better. Let's use the modified cobra as the example, because it's one of the most important corrective exercises for disc-related sciatica and one of the most commonly overdone. The therapeutic value of the modified cobra comes from gentle, passive lumbar extension. Hips on the floor, elbows providing just enough support to let the lower back extend slightly under its own weight without active muscular effort. Here's what happens when someone decides that if a small amount of extension helps, a larger amount should help more. They push further up onto their hands instead of elbows, sometimes even straightening the arms fully, trying to press deeper into the extension because it feels like they're getting more out of the exercise. At a certain point of increased extension, particularly performed with active muscular force rather than passive relaxation, the compressive load shifts. Instead of gently encouraging disc material forward, away from the nerve root, aggressive extension compresses the posterior facet joints, the small joints at the back of each vertebra, and can, in some presentations, place the nerve root under a different kind of pressure entirely. The person pushing deeper is doing the right exercise, but the intensity has moved it outside the therapeutic range and into a zone that can aggravate rather than help, and they have no way of knowing this because deeper stretching normally means more benefit for everything else in their life. The same pattern with the Piriformis release. The supine figure 4 stretch, ankle crossed over the opposite knee, thigh drawn toward the chest, is one of the most valuable exercises for sciatica caused by Piriformis involvement. The correct depth produces a firm, noticeable stretch sensation deep in the hip. That's the target. That's where the therapeutic effect happens. But because a stronger stretch sensation is usually associated with better results, many people pull the thigh further and further toward the chest, well past that firm sensation and into genuine discomfort, sometimes using both hands in real force to drag the leg deeper. Muscle tissue under that degree of forced stretch responds with a protective reflex. It tightens defensively rather than releasing, the exact opposite of the intended effect. What was meant to be a release becomes, physiologically, a bracing response. The Piriformis ends up tighter after the stretch than it would have been with a gentler, correctly dosed hold. Part 2, why this mistake is so widespread and so hard to notice. I want to explain why this specific error is so common because understanding the reason makes it much easier to catch in your own routine. Reason 1, pain tolerance gets conflated with correct depth. Many people with chronic sciatica have, understandably, built up a high tolerance for discomfort. They've been in pain for months. A stretch that would feel intense to someone without chronic pain barely registers as enough to them. So they keep pushing deeper, chasing a stretch sensation that actually signals they've moved well past the therapeutic zone. Reason 2, online content rewards visible intensity. Video demonstrations of stretches often show the visually dramatic version of a movement because it looks more impressive and more thorough. Someone modeling the exercise with a smaller, gentler range doesn't look as convincing on camera, even though the smaller range is frequently the more therapeutically correct one for an irritated nerve. Reason 3, no pain, no gain gets misapplied. This mindset serves people well in strength training and general fitness. It actively works against people with nerve compression, where the correct dose is often surprisingly gentle, and where pushing past a specific, subtle threshold flips an exercise from helpful to harmful. How to find your actual correct depth. Here is the practical standard the Health Fix Zone community uses for every stretch in the sciatica protocol. You should feel a clear, comfortable stretch sensation in the target area, the hip for piriformis work, the lower back for extension work. This sensation should be mild to moderate. It should never be sharp. It should never radiate down the leg. And critically, it should ease slightly the longer you hold it as the tissue relaxes into the position. If a stretch sensation is increasing the longer you hold it rather than easing, that's a sign you've gone too deep and your muscles are bracing against the position rather than releasing into it. Apply the centralization test here too. After any stretch performed at this gentler, correct depth, your leg symptoms should be moving toward your back or staying the same, never toward your foot. Part 3. Rebuilding your routine at the correct intensity. Here's how to recalibrate every exercise in your current routine using this principle. Modified cobra, stay on your elbows. Never progress to hands or straight arms during active sciatica. Hips stay on the floor without exception. The extension should feel gentle enough that you could comfortably read something or breathe normally throughout the entire 5 to 10 minute hold. Supine piriformis release. Draw the thigh only to the point of a firm, comfortable stretch, not the maximum range your hip physically allows. 45 seconds. If the sensation is increasing rather than easing partway through, back off slightly and hold at that reduced depth instead. Supine hamstring stretch, same principle. A mild to moderate pull in the back of the thigh, knee slightly bent throughout. If you feel any tingling, burning, or electric sensation down the leg during the stretch, you've gone too far. Bend the knee more and reduce the pull immediately. Glute bridge and dead bug. These are strengthening exercises rather than stretches, so the same gentler is often correct principle applies differently here. Full controlled range of motion is appropriate, but always stopping the moment the lower back arches or lifts off the floor, since that's the point where these exercises stop protecting the spine and start loading it. The adjustment period. If you've been pushing your stretches deeper than this for weeks or months, reducing the intensity is going to feel counterintuitive, even like you're doing less than before, like you're somehow regressing. Give this recalibration 7 to 10 days before judging it. Most people notice their symptoms beginning to centralize more consistently once the intensity comes down to the correct therapeutic range, precisely because the nerve and surrounding tissue are no longer being pushed into a defensive, bracing response with every session. Here's what I want you to leave with today. Doing the correct exercises is only half the equation. Doing them at the correct intensity is the other half, and it's the half that almost nobody explains because it runs against everything most of us have been taught about stretching and exercise in every other context. Gentle, controlled, and slightly short of your maximum range is not a lesser version of these exercises for sciatica. For a compressed and irritated nerve, it is the correct version, the one that actually produces the centralizing effect these exercises are designed to create. This is Dr. Dan H. from Health Fix Zone. If you realized you've been pushing your stretches too far, hit like right now. It helps other sciatica sufferers catch this before another week of unnecessary bracing. Not subscribed? Hit subscribe and the bell. Real clinical truth about sciatica and back pain every week. Comment below, have you noticed your stretch sensation getting more intense the longer you hold it rather than easing? I read every single comment. Not deeper. Correct. That's the difference between an exercise that heals your nerve and one that just makes your muscles brace against it. Now you know which one you've been doing. I'll see you in the next one.